own cheering section. So I don't have a PowerPoint. And we've presented before together, Red River, University of Winnipeg, and U of M, and so I'm glad Jess went first so I can basically say ditto and pass the mic over. Our services are quite similar. We've developed them at different stages, I think, over the last number of years. We have very similar programs to what Jess just mentioned. Our numbers are just over 1,100. Actually, I think we're at 1090. We might be just under 1,100. But growing, we're doing 15 intakes a week, so the numbers continue to grow. Our fastest growing population, students with mental health, I think that's close to 400 right now, maybe just under. And so we also, as Jess mentioned, do accommodation plans for students with mental health disabilities, visual impairments, deaf, hard of hearing, Asperger's syndrome, as Tim mentioned, is my area of expertise. Learning disabilities, ADHD, medical conditions, mobility issues, you name it. We're working with our professional faculties at the Bantoline campus, School of Medical Rehab, Medicine, Dentistry, Pharmacy, in providing accommodations for workplace and curriculum-based degree programs, so not just typical classroom settings, but also professional faculties, and I know Lorene at Red River has to deal with that all the time, as there's a lot of professional programs there. So we also, one of the things I wanted to add that maybe Jess alluded to is that we work in conjunction with a lot of different areas in the university. So because our biggest population growing, fastest growing population, students with mental health disabilities, we're working with the counseling center quite often in linking with them to do workshops and sort of sending them lists of students for their one-on-one counseling and anxiety workshops. Also the Psych Service Center, we work in conjunction with them as well in providing a list for psychoeducational assessments that take place on campus. So if a student comes to us from high school and their learning assessment is from when they were 10 or 12, 13 years old, they're required to get a new one. You can get a free assessment on campus. We have a 10-month waiting list right now, so it's pretty long. I just did a talk with some high school guidance counselors and resource workers, and they were envious that it was only 10 months long. They've got 2-year lists, so I guess who are we to complain? So yeah, they can get new assessments through the Psych Service Center and the Counseling Center to get, I mean, we all know that if someone's diagnosed with a reading disability, it's sort of quite similar from when they're 18 and 28. So we'll take a student on and give them interim accommodations while they're waiting to get a new assessment because the waiting list is so long, but they are required to get a new assessment. We work with the career counseling. We do career workshops. There's some job training involved in what we do in some of the workshops we do. So, and I don't know, you didn't mention how many staff you have. You've got yourself?
We have 5.5.
Five and a half?
Yeah.
Okay. We have, that's core staff or that's all staff?
Core staff.
Oh, core staff, okay. So we have 5 advisors, an adaptive technologist, 2 exam coordinators, so I guess 9 staff. So we also have about 80 to 85 part-time staff, invigilators, note takers, interpreters, computerized note takers, yeah, and academic attendance as well. So I'm going to pass it on to Lorene. I'm open to questions on our services, and yeah, here's Lorene. Or Tim, do you want to?